Okay, this is Dr. James Hardy from Midtown Obstetrics and Gynecology, and we're standing in front of the Vinci robot, which is used to do laparoscopic procedures and different surgeries in the hospital setting. Dr. Hardy, what is the easiest surgery, the most difficult surgery that has become the easiest one to date with this robot?
Well, probably the easiest surgery that was previously the most difficult one was the patient that's had other previous surgery and has scar tissue, and which would make their future surgery very difficult, and the robot lets it a little bit easier because of your ability to manage things laparoscopically that you couldn't with previous laparoscopic techniques.
Has it made hysterectomy procedures easier for women that come in when you perform them with this, or endometrial issues?
Yes, I mean, it's made hysterectomies, it along with laparoscopy in general, it made hysterectomies mostly spend one night in the hospital and go home the next day procedure. You have little small incisions instead of a big incision, so quicker return to work, quicker return to normal activities, less blood loss, less risk of infection, all the things that you read and hear about.
How long was your training on the machine?
Your training consists of doing some online training, and then you go for an observation where you watch somebody do surgery, and you go for an animal lab for a day, and then you do 3 proctored cases, and then after that you're ready to go. That just trains you to use the machine. That really doesn't train you to do the surgery itself. You still have to have the basic knowledge of how to do the surgery. You're just using a different instrument to do it with.
Has the instrument made it easier on you when you are in the operating room?
It really is. You can see better. You can actually sit down to do the surgery instead of standing up. So people that have back or shoulder pain don't have that anymore. You have 10-fold magnified vision as well as 3D vision, so it's a lot easier and safer and better for the doctor and for the patient.
And so do you see this the wave of the future in obstetric surgery, gynecologic surgery for women and throughout the country, the robot surgeries for us?
I think so. I mean, if you look at other places in the country where they're a little bit further ahead on the game than in Charlotte, you know, the open surgery rate is almost zero. And in fact, our practice's open surgery rate is very close to zero. We're able to do most things that we traditionally would have done with an open procedure laparoscopically now, which is great for patients.
Oh, fantastic. And remember, he is at Midtown Obstetrics and Gynecology. Thank you.